In this micro-teaching session, I will focus on enterotoxigenic Escherichia coli, commonly known as ETEC, as a cause of neonatal calf diarrhea. Although diarrhea in cows has many causes, today I will focus on one specific pathotype and explain how it causes disease at the cellular level. So by the end of this short session, you should be able to explain why ETEC causes profuse watery diarrhea and why newborn cows are particularly susceptible. I will begin with this clinical image, which serves as a visual starting point. Veterinary patients cannot describe symptoms, so clinicians must interpret patterns. This calf shows profuse watery diarrhea, contaminating the perineal region, this region. Notice what is absent. There is no blood, no mucus, no straining. This tells us diarrhea is not inflammatory. The sheer volume of fluid indicates that water is being actively secreted into the intestinal lumen. This strongly points to small intestinal involvement, which is characteristic of ETEC infection, especially in calves 1 to 4 days old. What's ETEC? Enterotoxigenic E. coli is a non-invasive pathotype. Unlike invasive bacteria, ETEC does not damage or penetrate the intestinal epithelium. Instead, it colonizes the small intestine, particularly the jejunum and ileum. Disease occurs entirely through toxin production, not tissue destruction. This explains why calves can become severely dehydrated while the intestine appears grossly normal. Steps in infection. After ingestion, ETEC reaches the small intestine and attaches using K99 or F1 fimbriae. These fimbriae allow the bacteria to remain on the epithelial surface. Once attached, ETEC releases heat-stable enterotoxin, abbreviated as STA. STA is the key driver of diarrhea. It disrupts electrolyte transport, leading to chloride secretion, reduces sodium absorption, and massive water movement into the intestinal lumen. Before understanding disease, we must briefly review normal small intestinal function. The small intestine is designed for absorption by maximizing surface area. At the gross level, circular folds slow intestinal transit. So these are the circular folds. These folds are covered by villi. So one villus is shown over here. And these villi greatly increase absorptive capacity. At the cellular level, enterocytes are epithelial cells. They possess microvilli. So these are the microvilli. This is an individual villus, and the plural of microvillus is microvilli. And these microvilli form brush border, and this is the brush border. And it is this place where electrolyte and water absorption normally occur. This is critical because ETEC does not destroy this structure. Instead, it hijacks normal transport mechanisms, converting absorption into secretion. Mechanism of secretory diarrhea. Once ETEC is attached, STA toxin binds to gonolate cyclase C receptor on the brush border. So this is the brush border, and this is a single cell. And these are the microvilli. And this is the STA toxin binding to gonolate cyclase C over here. And this is the gonolate cyclase C. So binding of STA with gonolate cyclase C receptor increases cyclic GMP. So this is cyclic GMP over here that is increased by the activation of gonolate cyclase. Elevated cyclic GMP activates protein kinase that inhibits sodium absorption, particularly through sodium hydrogen exchanger, as is shown over here. At the same time, cyclic GMP indirectly stimulates the CFTR chloride channel. So this is the CFTR chloride channel. It's activated by binding of STA with gonolate cyclase C receptor. Chloride and bicarbonate are secreted into the small intestinal lumen. So this will be the small intestinal lumen. Water follows these electrolytes by osmosis, resulting in profuse watery diarrhea. Because epithelial cells remain intact, there is no inflammation, explaining the lack of visible lesions. The question arises, why are neonatal calves highly susceptible? Neonatal calves are uniquely susceptible for two main reasons. First, K99 or F5 receptors are present only in newborn cows and disappear with age. Second, cows are born A-gamma globinemic. They don't have any antibodies in their blood and rely entirely on colostrum for passive immunity. Failure of passive transport is therefore a major risk factor for ETEC covers or diarrhea. Take-home message to conclude: ETEC causes secretory diarrhea, not inflammatory disease. Disease is toxin-mediated. It's toxin-mediated, not invasive. Severe dehydration can occur without intestinal damage. Effective prevention depends on early immunity and colostrum management. Understanding this mechanism allows veterinarians to better recognize, prevent, and manage neonatal calf scours. Thank you so much.